Now, you're a member of the American, I don't want to mess this up, there's a medical association that you're a member of.
Well, I belong to the National Medical Association and not the AMA.
So
and
you're the National
National Medical, and I'll tell you the difference. The National Medical Association is predominantly black, and the AMA is predominantly white. Now, the question comes, why do we have the two separate organizations? Well, if we think in years past, the AMA, which is the American Medical Association, did not see fit to allow African American physicians to join the AMA. I'm talking back early years, 1850 and on. And as a result of that, the National Medical Association, which, by the way, I'm going to be attending the convention in Atlanta, Georgia next week, was founded in 1895 out of necessity. If we as African American physicians had been allowed to join the AMA like any other white physician, there never would have been a need for another organization. But it was founded out of necessity because they did not allow us to join the American Medical Association. And in fact, the journal, the JAMA Journal, Journal of American Medicine, the July issue, in their journal, there's an article where the AMA is apologizing to African American physicians for the years of segregation that they either allowed to happen or looked the other way. Mm-hmm. In other words, even when the AMA had started allowing African Americans to get into the American Medical Association, there were certain local societies, say in the southern states and even some in the northern states, who, if they decided that they didn't want an African American member in that local society, the AMA, which had the authority to say, if you don't conform to our rules, we're going to kick your society out of ours. They didn't do that.
Okay.
They just turned the other head the other way and let it happen. And there's a wonderful article in the JAMA which expresses an apology for all of this happening. And while I'm talking about that, I certainly would be remiss if I didn't say that in view of all that I've been able to achieve in my life, there were a lot of individuals right here in Youngstown who really, I stand on their shoulders because they did not have their opportunities. If I stop and think of Dr. W.P. Young, who practiced in Campbell, Ohio for years and probably was not allowed to join the medical staff of a hospital here in Youngstown until probably the mid-50s. And I think he started practicing in Campbell around about 1938.
So when you say not able to join the medical staff, that means that he just has his private practice, but he can't.
All he could do was practice in his office.
So what happens when his patient needs to be?
See, and here's what happened. You know, you'll see a lot of times people will say, what developed from that? And this is what happens because people learn things by experience. What would happen from that, as good a physician as Dr. Young might have been, or Dr. Lander, who had his own little small hospital right where the right at Walnut and Rayan Avenue, where the old Ivy Room used to be. That was his office building there. No matter how good they were in their office, they couldn't practice that skill in the hospital. So the feeling then amongst black people in the community comes out, if you really get sick and have to go to the hospital, you better get yourself a white doctor. And the reason for that is you had no choice. You had to get yourself a white doctor because a black doctor could not practice in the hospital.